Dr. Ron Receveur. Thanks for joining me for this presentation. We see many patients that have missing teeth and no longer want the old way of replacing those missing teeth with dentures and partials or grinding down their adjacent healthy teeth for bridge work. This short presentation will show you some of the options available to replace those missing teeth in such a way that you don't damage the adjacent teeth, nor do you have to wear a bulky denture that covers the roof of your mouth or digs into your gums. Many of our patients are surprised by all of the options that are available to them now. This presentation will help educate you about all those options and give you some answers to some of your problems. The most common complaint we see is a lower denture that's sore and digs into the gums underneath the denture and pops up. It won't stay in place. One of our patients, Lonnie, had dentures for 35 years before coming to see us. He had a long list of complaints with his dentures. He chose to have an all-on-4 where he could eliminate his dentures and have something that was permanently fixed in his mouth. Now he can have taffy and apples. He can chew or eat anything he wants without having a sore spot. Lonnie is the typical patient we see every day. 8 million people have had dental implants. People who chose to have something permanently fastened in their mouth as opposed to a removable denture. There are 60 million people with dentures. Some of the new options may surprise some of you with how easy they are and their affordability. You're not alone with your denture complaints. More than 240 million people in this country are missing teeth. So a lot of people have difficulty chewing and eating their food, which means that they don't chew their food well. Subsequently, they have stomach problems, intestinal problems, poor nutrition, and they don't get to enjoy the food that they want to eat. There are many solutions that give patients the ability to chew anything that they want. The emotional side of missing teeth is something that is seldom talked about. But when we sit down with patients and spend time and get to know them a little bit, they start telling us about how they're depressed and how stressful it is to go out to dinner with their family and on special occasions. They have depression over the condition of their mouth. They don't have as much confidence. They are uncomfortable interacting with people that they don't know so well, and they avoid certain social situations. It's amazing how much their missing teeth or dentures affects the rest of their life. I show many patients how their missing teeth and dentures make their lips and cheeks look different, how they have creases and wrinkles around their mouths. I tell them I can make the whole lower half of their face look better. The loss of support for their cheeks and face makes them look older. This is the result of having dentures for many years. When you only eat soft foods that you're able to chew, many times you're missing the minerals, the nutrients, and the vitamins that you need to be healthy. If you can eat anything you want, you're going to eat more apples, fruits, crunchy vegetables, and foods that will make your diet and overall health better. There are also many studies that show that people who don't chew their food have a much higher incidence of colon cancer, stomach problems, and other kinds of health-related issues. Dr. Charles Mayo, the founder of the Mayo Clinic, said good dental health can extend human life 10 years. So it's very simple to understand that being able to chew your food and getting the proper nutrients and vitamins will give you a longer lifespan. So let's talk about what happens when you lose a tooth. When you lose a tooth, the bone resorbs or shrinks away and you lose support for your cheeks, lips, and face. When that occurs, the lower part of your face starts to look older and have wrinkles. I had a patient in our office recently that told me she went to a plastic surgeon to have a facelift because the lower part of her face had a lot of wrinkles and it was sagging. The plastic surgeon actually told my patient that she didn't need plastic surgery. She needed to come see me because she had lost vertical height in her bite. Here you can see an illustration showing how resorption occurs and the bone gets melted away. Patients that have resorption will actually find that their jaws come closer together. It makes the lower half of their face look older. It actually can get so extensive that it starts impinging on nerves and soft tissue. And that's when it becomes more painful and much more uncomfortable when you're trying to chew food. Significant resorption leaves patients with nothing but soft, flabby tissue for their denture to sit on. It's like walking on a gravel driveway barefoot. It's tender, soft tissue with hard denture acrylic pounding on it when you try to eat. Missing teeth changes your appearance. It affects the way your lips look. We have ladies that tell us that their lips look fuller and the way they used to when they were younger. They talk about putting lipstick on and how their lips look so much more natural and full when the lower half of their face is restored to a normal height. A healthy tooth is made up of two components, the root and the crown. The crown of the tooth is basically the chewing surface. When you lose a tooth, you don't just lose the chewing surface, you also lose the root. When you lose the root, the bone changes. It atrophies or shrinks, and then when you put a denture or a partial on top of that, you're adding insult to injury and putting pressure on the bone, and then it shrinks even more. The three primary methods to replace missing teeth are removable appliances, fixed porcelain bridge work, and complete replacement with implants. This complete replacement is the only method that replaces both the root and the chewing surface that was lost. Years ago, most patients with missing teeth would have flippers, plastic partials, or dentures. All that did was replace the chewing surface. It did not support the bone. In fact, it put chewing pressure on the gums and bone, causing the bone to melt away. Let's talk about the pros and cons of the different options available here. Flippers, partials, and dentures trap food under them and move around in your mouth when you try to bite. All of them reduce the ability to chew food and just sit on top of the gums. They are supported by the gums, so you're going to have sore spots because there's pressure on the gums. When you have a denture, you lose support for your cheeks and your face. These tooth replacement options are the quickest and cheapest alternative, but they're also the least comfortable. Another choice is a fixed bridge, which is attached to the adjacent teeth. What we're doing now with implants, whether it's an implant-supported denture, an implant-supported bridge, or an implant-supported prosthesis, is we're replacing the crown and the root. So we're not just replacing the chewing surface, but we're also replacing the root, which protects the bone. Replacing all the components is the most natural and healthy thing that you could possibly do. Implant-supported bridges are cemented in permanently. You cannot remove these. These are one of the most secure options, but it is also the most expensive. Bridges or all-on-fours are extremely popular permanent choices. These are screwed in permanently and are the treatment option that is closest to your own natural teeth. We do a lot of overdentures. It is the most popular option when you consider all three factors. The benefits of the overdenture are it's less costly than implant-supported bridges. Because they are removable, they are easier to clean. Oftentimes, the amount of effort and surgery is less than the implant-supported bridge work.